Hello everyone, good evening. I'm Shreya Dhoundial. It is good to see you. Today on Debrief, an informed discussion on the only COVID toolkit that should really matter at this point of time. Plasma therapy is out of the treatment toolkit as far as the government of India is concerned. Are steroids next? Steroids have a bit of a reputation in the world of sport, but in the world of medicine, it is commonly used to reduce inflammation and ease symptoms like swelling, pain and stiffness. Essentially, steroids are the man-made form of hormones. Now, in COVID-19, steroids were being used to treat moderate and severe cases. Till came the black flag, black fungus. The government of India now says limit the use of steroids because it is pushing up cases of mucormycosis, especially in the elderly and the diabetic. So much so, the injection that is used to treat it has suddenly disappeared from shelves of India. After plasma therapy, will steroids go next? We have three doctors on the show who are talking about steroids. One of them, a psychiatrist, to talk about steroid-induced psychosis that is being reported by many people across India. Before we go to them, a quick look at the good, bad and ugly of the steroid story so far. In June 2020, the recovery trial by the Oxford University first used a short course of the cheap and widely available steroid dexamethasone, 6 milligrams for about 10 days for hospitalized COVID-19 patients who needed oxygen support. The research found that it made patients live longer, but the same trial also showed that if it was given to patients who did not need oxygen support and were not severely ill, it had an adverse effect. Since then, dexamethasone has been the breakthrough drug in saving lives. The WHO is recommending it as well. In the first 5 to 6 days of COVID-19, the virus replicates in the body. In the second week, steroids are used by doctors to tamp down the body's immune system, alleviating inflammation, swelling and pain. So steroids given in the first 5 days of symptoms have no benefit. In fact, they can cause more harm since they suppress the immune response and make the virus replicate itself even more. Steroids are one of the cheapest and most effective therapy in COVID-19. But confusion over its use has led to their massive abuse in India. As the second wave engulfed India, overwhelming hospitals and making patients gasp for breath, doctors started over-prescribing steroids. In many cases, people even started taking steroids on their own from day one of the symptoms. Public health experts are now blaming this indiscriminate use of steroids as the likely cause of mucormycosis, or black fungus. Giving steroids at a high dose or for a prolonged duration can cause other complications as well. Taking high doses of steroids in mild cases could lead to severe viral pneumonia. Steroids especially have harmful effects in the elderly and the diabetic. Steroid-induced psychosis that makes people aggressive and anxious could last for more than a month.
If you have someone who has mild disease or who is having very little symptoms, he has just fever, he has cough, but his saturation is 97, 98, he doesn't need steroids, he doesn't need remdesivir, he doesn't need to be hit hard. He's those in that 80-85% who will get all right with mild asymptomatic treatment. And this is a treatment strategy which is being done in the US, in the UK, in Europe.
Once they're in the hospital and require mechanical ventilation or high flow oxygen, that's a different type of a pathogenesis. You've got to suppress the inflammation and the aberrant immune response. That's the reason why dexamethasone works so well. And dexamethasone and baricitinib and other things that suppress inflammation. So you have to have two poles of the treatment, one early on to prevent people from going to the hospital. And then once they're there and they get seriously ill, you've got to suppress that aberrant inflammation.
As black fungus cases rise in India, don't pop steroids just yet on your own without consulting a doctor. It's a double-edged sword, so tread with utmost caution. With NC Satpathy, in New Delhi, I'm Shreya Dhoundial. There is so much information regarding COVID-19 treatment available publicly that 90% of us feel that we are in a position to advise our doctors on the line of treatment, or even just start popping steroids on our own, since self-medication is a purani bimari in India. All of us are guilty of it. 3 doctors are joining me today to talk to us about what steroids do to our body and, very importantly, what they do to our mind. Dr. Ravinder Mehta is joining us. He's from the Apollo Hospital. Dr. Lancelot Pinto with us from the Hinduja Hospital in Mumbai. And we have Dr. Harish Shetty. He's a senior psychiatrist, consults with Mumbai's Hiranandani Hospital. Dr. Mehta, I'm coming to you first. The question is this: till 3 months ago, or even till 3 weeks ago, we were told that steroids is a ramban, that in moderate and severe cases, this is what will save you. Isko laga dala to life jhinga lala. Now we are being told more harm than good. Can you please explain to us why steroids are used in COVID-19 treatment in the first place, and if the side effects that everyone is now talking about has come as a surprise to doctors like you?
Right. So I think what you played before we came on, and Dr. Guleria's statement or Anthony Fauci's very clear call over there, is that steroids have a certain role to play. Truthfully, to give them the true place in the algorithm of COVID-19, they have been a magic or miracle drug, because that was the first treatment apart from oxygen, which in July of 2020 shook the world, and in 15 hours flat, the entire world did take to change its practice. At the same time, there are always a but and a between the lines for every drug. And the UK people clearly said in the recovery trial that please don't use it in the early stages when there is viremia, as you were saying, and that can be detrimental. Unfortunately, that message got missed over there, and we started to swing a little too early and a little too late. Both sides, it's been going on. India being what it is, a center of diabetes, having this sort of attitude and not following guidelines, because it's been rampant all over the place when practitioners have been following what they think is correct. We have this overuse, and truthfully, if you did not get mucormycosis, you would not be looking at steroids so carefully. Correct. So again, it is science which has been talked about, nothing new. It has to be reinforced. Use it at the right time. Don't use it too early. Use it in the right dose. Get out over there. When you're using it, you make sure that you take all the precautions like diabetic control and so on. And then we'll probably hit the right sweet spot where it's supposed to make a big difference in COVID-19 mortality.
Dr. Mehta, before I go to Dr. Pinto, wasn't this exactly what was said about plasma therapy some 6 months ago? And now you have plasma therapy that is out of the COVID protocol treatment in India?
So plasma therapy has gone through this interesting thing where we repurposed every therapy. So if you look at plasma therapy, why it starts in 2020 is very justifiable. You don't have everything. You're taking skeletons out of the closet. You're throwing the kitchen sink at people. And it was used in SARS-CoV-1 and Ebola for trying to increase passive immunity at the right time. Now, 1 year later, 80,000 papers plus in literature, science has gotten smarter, and it's been shown that this is not effective. It is probably having a role, if at all, in a very small segment. It cannot make it to guidelines. And by and large, making people run all over the place to get a medication or a therapy which does not work effectively is not mandated. So very maturely, we think it's a positive step. The science is auto-correcting and saying what we started is not what we want to recommend. And this is the story of COVID-19. It's now a very coned down approach compared to the broad spectrum. I mean, you've done a series on HCQ with us. You looked at remdesivir carefully, and plasma is just adding to the same concept with appropriate guidelines for people to follow now.
Okay, so you don't think what has happened to plasma therapy will happen to steroids? Because anecdotally, most doctors like you feel it does work. Dr. Pinto, what has been your experience with steroids over the last, say, 1 year?
I think the experience has been pretty universal across the board. I don't think you will find a single doctor who tells you that steroids, when given for the right indication, do harm. And that right indication was proved in a very large trial with a large number of participants, where they said that when a person's oxygen levels drop, usually that happens towards the end of the first week. Usually that's when there is a hyperimmune response where the body has gone into an immune overdrive. If you use 6 milligrams of Dexa or its equivalent and you use it for up to 10 days and not longer than that, there is a significant improvement in a majority of the patients, in a good majority of the patients. And our experience has been no different. We have used DEXA. We've been fortunate enough to never have a shortage of DEXA. I know there are parts of the country where DEXA is not easy to get. But even if you use the equivalent, so that would be methylprednisolone, somewhere about 40 milligrams a day if you're giving it intravenously, or prednisolone 40 milligrams a day, it does save lives for sure. It does cause the hypoxemia to get better, the low oxygen levels turn around. The strong immune response that you see, whether it's in terms of inflammatory markers, whether it's in terms of clinical markers, seem to get better with time. And a significant proportion of individuals do turn around once you start them on steroids at the right time.
So, Dr. Pinto, let me ask you this. If I come to you as someone who has 102 ka fever for the last 5 days, my fever is not going away, and I come to you and say, doctor, I'm worried, I'm anxious, please don't send me away with just a paracetamol, I need more. What do you do in a scenario like that? Because if you administer steroids to me, it has an immediate impact on my body, right? The fever will go.
Right. So early on in the pandemic, there was concern around the use of stronger drugs for fever, which were, which we call non-steroidal anti-inflammatory drugs, drugs like ibuprofen. There was a concern that the ACE2 receptors get influenced in some way, and therefore it might be detrimental for COVID. We now have a large body of research, which again tells us that it's safe to give stronger drugs for fever than simple paracetamol. So yes, I would start with paracetamol. But if someone's fever is not settling on day 4, day 5, if everything else seems to be going in the right direction, so a person doesn't have a worsening cough, a person doesn't feel more breathless, the oxygen levels haven't budged. So let's take a nuanced view in this. So when the cutoff which was used for the recovery trial was 95%. But if I had an individual who from day 1 was 99% and suddenly says, now I have become 96%, yes, that would be a cause for concern. That would put this person on my radar. I would be a little more cautious with an individual like this. But just because he or she is having fever, I don't think it's warranted to start steroids at this point. You need reassurance, and it takes a lot of time, because you have to reassure a highly anxious person, a person who has heard of a lot of deaths around him or her, a person who's heard of all sorts of bad things happening in the country. There is this problem of, will I get a bed if I deteriorate or not? Will I get an ICU if I need one? In that context, to pacify a person, to reassure a person is challenging. But I think as healthcare professionals, it is our responsibility to do the right thing.
Dr. Mehta, Dr. Shetty, give me a minute. This is a question I really have been wanting to ask a doctor for a while now. Dr. Mehta, if in the pre-COVID era, you had told me or other patients as well, I'm assuming, that we have to start you on a treatment of steroids, I would have said, doctor, koi aur ilaj hai to kar dijiye, please don't use steroids on me. How did we come to a situation where patients and their kin are coming to doctors and asking them ki bhai steroids shuru kar do, hamara fever niche nahi ja raha? How did we get to a place where people are buying steroids from over the counter and popping them?
Share on a slightly light note, this observation we made in some other forums. A country which never liked medications is popping medications like crazy. A country who looked like steroids, like the last thing they should take before they exit the earth, has been asking for steroids. A country which never liked scans is doing scans like crazy, and people who never like hospitals are trying to get into hospitals. So this has been the story, but COVID-19 has changed the whole picture, because ultimately it came down to one thing, that data showed that only 3-4 things work. Oxygen, steroids, and at the right time care given in hospitals is going to make a difference to your overall management, and some new drugs have come now. So that's why I think in the fear and the panic and looking at how things can go, especially in this second wave, whereas Lance pointed out that you're not going to get a bed, you're seeing death, demise and drudgery around you, that's when people accepted anything. The problem is it swung from nothing for the last 100 years to all the way the other side when they were prematurely used longer, and ultimately have led to this black fungus, which is the reason they've come back. Steroids should have been in the news for famous stuff when they were saving lives. Now they're there for all the wrong reasons when they still are saving lives if we use them properly at the right time with the right thought process.
Okay, I want to ask you about the link steroids have with black fungus and with lung infections as well, and whether it is specific to only diabetic people and the elderly. But before I come to you, there is a side effect of steroids which many people, I don't know whether they know about it or not, but I just got to know about it recently. I saw this in my family, Dr. Shetty. there's something called steroid-induced psychosis. Could you tell us what this means? A lot of people, and not just by, mind you, Dr. Shetty, not just the elderly, even young people are reporting it.
Just before that, I would like to spend 30 seconds on the state of the mind of the population of India. In an angst-driven society, people will believe that every drug which is publicized is Brahmastra. And when there are angst-driven doctors, they'll fire all the guns to save the patient. So these are the two important issues which are very important for us to know. The third thing is steroids can cause mood changes. It can cause abnormal behavior. It can cause psychosis, that is loss in touch with reality, and the patient may go berserk inside the ward, thereby pulling all his life-saving apparatus and might start moving around inside the ICU. So it is very important for us to understand that the physician should give steroids only when necessary. An angst-driven physician should first calm himself down, a lot of yoga, a lot of mindfulness, so that he does not fire all the guns, because there's a lot of pressure from the patients. At the same time, I strongly believe that physicians should work very closely with the psychiatrist, in the sense there's no need for the psychiatrist to visit every patient, but at least there's a backup doctor who's there in case of emergency, because psychosis can also be easily controlled. But what is important is, people know all medications. People believe that they will die, and before they die, they would want to use every gun or every arrow, and they believe that every arrow is Brahmastra. The doctors are extremely stressed, and they also believe that they need to fire all guns to save the patient. Steroid psychosis can disrupt the patient's life. It can cause a lot of danger to his own health, and it can really harm his physical state. So it's extremely important that doctors are mindful, they are peaceful, they're not pressured by the patients, and they do what science tells them the best.
So Dr. Shetty, very quickly then, my follow-up question. Say, a patient has been given 10 days of steroids. I think that is the usual course. Correct me, Dr. Mehta, if I'm wrong, and Dr. Pinto, if I'm wrong. After that, how long will the impact last? Will it last? You've stopped taking it, right? After that, how long does this impact last of patients being anxious or extremely aggressive, etc.? Will it last a month, a year, 2 years?
There are individual variations. Those who have been on antipsychotics, or those who have had history of psychosis, may have a very difficult recovery, and it depends upon individual patients. That there may not be a hard and fast rule for them to recover, but if they have had psychosis, most of them should recover in a few weeks. At the same time, anxiety and mood changes are seen inside the ICU. Sensory deprivation is also a very common cause of psychosis. So a backup psychiatrist is as important as a life-saving physician.
Good point. Dr. Pinto, quickly to talk about this link between black fungus and steroids. Is this link that has been established with all the data that has been collected so far, or is it just anecdotal? And what is the link? Many people will say steroids is one thing. How is it inducing black fungus, which is a fungal infection?
So fungi are present in the atmosphere all around us. Right now, as you and I speak, we are inhaling fungal spores, we are inhaling fungal filaments. If you keep bread outside, there's fungus that grows on it. So this is something that our body's native immunity manages to ward off on a day-to-day basis. So when this immunity goes down for some reason, that makes us susceptible, that makes us vulnerable for these fungi to get a foothold in our lungs, in our nasal cavities, in our sinuses. Now, it's not only steroids that do this. So it's steroids, it's immunosuppressive drugs. For example, tocilizumab is being used a lot, and that has been associated with invasive fungal infections. If you're on cancer chemotherapy, if you're on other drugs for autoimmune conditions in which your immunity is lowered, these conditions make you susceptible to this black fungus. What also adds to this is if your blood sugars are high. So we know that uncontrolled diabetes is a risk factor for invasive fungal infections. And unfortunately, steroids lead to sugars going high, whether you have diabetes or not. So even in a non-diabetic person, or a person who's not aware of the fact that he or she has diabetes, taking high doses of steroids for prolonged periods can raise your blood sugar. Another factor which also needs to be factored in is the fact that viral infections themselves lower a person's immunity. So we know for a fact that another fungus called aspergillus is seen in patients after they have influenza. It's not uncommon. Bacterial infections are seen post-viral respiratory infections as well.
Okay.
So it's multifactorial in that sense. So it's a combination of your sugars, your immunosuppressive drugs, the viral infection itself. I think this is the environment in which the fungus gains a foothold in the lungs. So I don't think it's just one factor in itself. I think it's a combination of a lot of different factors.
Okay. And Dr. Mehta, before I go, steroids, the after effects, is it just psychosis and black fungus, or are there other things that we need to worry about as well, or if not worry about, keep a lookout for? Is steroids only just impacting us with black fungus and psychosis? Is there anything else as well?
No, this is an excellent question with a broad message, because see, if you go back and dial the clock back, people like Dr. Pinto and I have been using steroids for a long time for asthma, COPD and many other conditions, and so have other specialties also. So steroids given appropriately, for example, if you follow that 5 to 10 day course mentioned in the recovery trial, stick to it with the right monitoring, sugar and all the stuff talked about, there are very little sequelae. When you look at COVID, it's all a question of advantage and risk. So the risk-benefit ratio here favors the fact that you give steroids to the right people and exit in time. If you do that, then we don't have a discussion like this, because a lot of good will happen and little detriment will happen. Every drug, Shreya, comes with some side effect. But for COVID-19, steroids in the right dose still, as of today, will stay as the right drug, because recovery trial will not happen again. No one's going to do the study all over again. And at this point, we have seen enough clinical advantage that we just need to give what message you're trying to give. Use it right and use it appropriately.
Okay, we'll leave it on that note then. Thank you very much, Dr. Pinto, Dr. Mehta and Dr. Shetty for joining us on the show. We are putting up this conversation on our website, news18.com as well. Thank you, doctors. Be well, be safe. On that note, a very quick break. Up next, why dung therapy has many doctors very worried. Is it a black practice that is causing black fungus? That report is coming up next. Do stay with us. Welcome back. Can dung therapy keep you safe from COVID-19? Some good folk believe it can, but the good doctor is advising strictly against it. Here is why. In a cow shelter in Ahmedabad, people smearing cow dung and cow urine all over their bodies. Why? Because they believe it will ward off COVID-19. But experts are raising concerns that this experiment could backfire and invite black fungus, also known as mucormycosis. This cow shelter in Gujarat, run by the Sri Swaminarayan Gurukul Vishwavidya Pratishtanam, gets a steady stream of visitors every week. Most of these visitors come to this cow shelter to undergo cow dung therapy, which they feel will protect them against COVID-19. During the therapy, cow dung is smeared all over a person's body in the belief that it increases immunity and speeds up recovery from COVID-19. The cow dung is later rinsed off using cow's milk and cow urine. According to officials at this cow shelter, those taking the therapy include some frontline workers as well. The increase in this practice, especially in the second surge, has raised concerns amongst medical health professionals. Some doctors say cow dung therapy increases the possibility of fungal infection called mucormycosis or black fungus in COVID-19 patients. Now, besides the possibility of disease, cow dung therapy promotes a false sense of immunity which can prove to be lethal.
There is no scientific evidence to prove the cow dung can be used as a treatment or immunity booster against the corona infection which is prevailing. People should also understand when using an excreta of cow, which is being considered as a sacred animal, that is bound to increase some zoonotic or infectious disease more.
Ahmedabad has been witnessing 10 to 12 new cases of black fungus daily. So much so, the administration is now setting up a separate facility to treat these patients suffering from black fungus. So, moral of the story, cow dung chodo, mask pehno, and not one but two to save yourself from COVID-19. Thanks very much for watching, everyone. Good night. I'm signing off here.